Hi, I'm Nigel Kent, and welcome to the Big Tech Watchdog. This is the program where we take freedom of speech seriously and follow up on all the crimes against humanity being conducted by the big technocracy, or as I prefer to call them, the big tech mafia. Today I'm joined by Dr. Keith Rose, who is an outspoken defender of personal freedom and the Constitution. He's a former Army captain who was assigned to a forward surgical team. And when he left the military, Dr. Rose continued to work as a tactical medical physician, training military law enforcement and government agencies. In 2008, Keith developed and patented the integrated tourniquet system, which has been used by Navy Special Warfare, law enforcement, and militaries around the world. Today, Keith is CEO of Rose Medical Management, a South Texas-based company providing a variety of medical services. In addition to his private practice, Keith continues to perform charity work as well. Finally, Keith is the host of The Scalpel, a regularly published podcast that cuts to the truth of the political landscape using history and experience. He blends writings from the founding, lessons from history, and current events to expose the mounting threats to the freedoms we enjoy as citizens of the United States of America. Welcome to the program, Keith. I'm so glad that you gave me some time today.
Thanks for having me.
Very welcome
I apologize.
indeed.
My voice is a little rough. I've been experiencing the Omicron, but it's not that bad.
I've heard that it's not that bad, and I certainly hope that it's not that bad for you. We are living in a period of infamy, you said on one of your episodes recently. Can you unpack that? It's a fantastic phrase, and it has so much meaning. Why do you say that we're living in a period of infamy?
We're living in a time right now. I was quoting President Roosevelt when he was talking about Pearl Harbor.
Mm-hmm.
And it was a time that will live in infamy because it was a very tragic situation. And when you have a period in infamy, you have to have people step up at that time in order to course correct or to protect what they've built. We were attacked, and quote unquote, we weren't attacking anyone else. We had stayed out of the war. So it was an unprovoked attack. And I feel like what we're going through now is a period that is even more relevant as far as an unprovoked attack, not just on the people of America, but on our way of life. And it's going to take, like World War II, it's going to take courage. And a lot of people don't understand, I believe, the real definition of courage. You mentioned something before we were talking. You said I had some authority. And a dear friend of mine the other day asked me what I thought humility was. And I gave him a lot of different answers. And at the end of the time, he said, those are all fruits of humility. But humility is actually having the courage to step into your authority. And when you don't have courage, truth is an orphan.
Mm.
And I think that's where we are right now. We have some people that lack the courage to step into their authority or exert their authority. Truth becomes an orphan, and then we live in a period of infamy.
Do you think that people who may be afraid to step into their authority would be other physicians? And do you think that there is such a thing as corporate bullying in the medical field?
Well, absolutely. I think it's more appropriately, I would say, corporate capture. I think that I know it's true in the pharmaceutical field. What's happened right now, and you come from the tech world, you'll understand this. Back in the 90s, a lot of all the testing for the big pharmaceutical companies was done through major government agencies, the CDC, the NIADH, the NIH. And so they had their lobbyists come in and very, I think, sneakily, if that's even a word, they were really shady about this. They came in and said, look, you guys are doing all of our testing. We should support some of that through taxes. So why don't you let us pay some of your budgets? Mm-hmm. And so now all the big government agencies, NIADH, NIH, CDC, 45% of those budgets are paid by the same companies that they regulate. And we call it regulatory capture. And so these groups are beholden to they're testing the drugs of the companies that are paying them. And what could go wrong with that? And so we're seeing that we're entering a time right now where people are afraid to stand up because it's a powerful structure. You saw it in the tech community when they started canceling people, when Amazon servers, shut down Parler, when you see this massive regulatory capture on one end and canceling on the other.
Mm-hmm.
And so people become afraid. And that's why true humility is having the courage to step into your purpose, to your authority, and speak up. Otherwise, the truth is an orphan. And when you have that happen, you have what we have right now, which is a lot of people suffering and a lot of people dying unnecessarily.
So that's a great illustration. On one side, you've got in infiltration and capture of a segment of an industry or of an entire industry. And then on the other end, you've got another industry that's doing everything they can to say that that capture isn't occurring, or denying people access to their peers who say that it is occurring, saying, no, he's crazy. It's a conspiracy theory. But yet, I'll tell you what, the stuff that has come out as honestly the truth, indisputable truth, over the last 2 years, I would have thought I was crazy if some of the stuff that was considered a conspiracy theory 2 years ago that we're now seeing in terms of manipulation of data about the COVID pandemic, manipulation of information about the testing, the way I believe it was the NIH that kind of walked back their reliance on PCR testing several months ago. But yet that's still considered that's still the way they're telling everybody to diagnose this thing. And if you step back and look at it, it looks like nobody who's in the know is operating in a coordinated or cohesive way. Because if you kind of say, well, why did they just reverse this? I mean, they were so heavily committed to this thing. Now they've reversed it. Now they've reversed it again. It's worse than political flip-flopping. And it doesn't really make any sense, I guess, until you look at it through the lens that you just provided, which is they're just trying to get away with something. I mean, I don't want to sound too conspiratorial here, but if they are trying to get away with something, is it purely economic, in your opinion, or do you think there's more to it?
Like science, I think it's probably multifactorial, not to confuse people, but I think you have to. A lot of times when I look at things, I go to the 100,000-foot view. You've been in tech, you've been in big business. You want to understand the landscape. Right now, we're seeing mainstream media and certain organizations and heads of organizations come out and say what we've known for a long time. You said, like a lot of people, we don't want to call it a conspiracy theory. It's not. It's not a theory when it's identification of a conspiracy. Mm-hmm. The whole phrase conspiracy theory was invented by the CIA back in the 60s to confuse people and to throw people off the scent. And so what you're seeing right now is people are coming out and admitting what we've known the entire time, what we've already seen. And the way I believe the reason they're doing that, when you see mainstream media come out and go, well, we're seeing that masks really don't work, but mask up. We're seeing that the vaccines aren't effective, but you still need to get your booster. Mm-hmm. What they are is they're laying the seeds so that 6 months from now, if something comes out that shows they were galactically wrong, which is going to happen, they'll say, no, we talked about it. It was a non-issue. We've already talked about it. They did this with President Trump and the whole Russian collusion thing. When they finally realized it was all a hoax, they slow dripped it out. And then when people bring it up, they say, oh, that's not a surprise. We've already talked about that. And then you hear radio silence, which is an oxymoron. You hear nothing. And so that's where we are right now. And the travesty here is they're not just pushing a narrative. People are dying. People are dying because there's medications out there that work. People are dying because they're being forced or coerced into taking a vaccine that hasn't been adequately tested. Mm-hmm. And when you talk about that regulatory capture, and when you say, how can they be so coordinated? How can you have an entire pharma industry work with an entire media industry, work with an entire government bureaucracy, and it's functioning like a symphony, blocking information, promoting misinformation in the name of blocking misinformation. And then
calling the truth misinformation.
Correct. And they said they were going to do that early on in Event 201. You can go online and actually watch the videos of that in October of 2019. The head of a public relations firm said, we're going to block, quote, misinformation. The interesting thing, however, though, if people want to understand the coordination, I like to think of a marionette, a puppet master. They hold the sticks, and the strings come down, to big pharma. They come down to media. They come down to government officials. But who's holding the strings? What's that wood made out of? It's made out of really 3 companies. And this is easily verified. It's made out of Capital Street, Vanguard, and BlackRock investment groups. Those 3 investment groups own all media, all big pharma, all the companies that are involved in this regulatory capture. So where it seems like you have independent companies, when you get back to the hidden hand are those large investment groups. And the irony is Vanguard owns BlackRock. So really one of those is owning the other as far as the big 3. And not to be confusing, but it helps to understand if you have investors in those 3 groups, they're using all the sub companies below to push and make money. And there's been a massive transfer of wealth from the muscular class to the elites. I mean, there's no other way to say that, because if they hadn't blocked some medicines that are just simple, hydroxychloroquine and ivermectin, had they not blocked that, then you would have no emergency use authorization, you would have no vaccine, you would have no lockdowns, and you would have no wealth transfer. It's that simple.
But the subversion of such widely accepted truths, why that doesn't sound alarm bells with people is mind-boggling to me, because they're even suppressing information about zinc and vitamin D and exposure to sunlight. Yes, I mean, these are things that have been well established and pretty much considered scientific facts and truths, even for the layman, since long before I was born. So how in the world are people not going, wait a minute, they're telling us that the sunlight doesn't matter, and they're telling us that zinc is irrelevant and all this stuff. It boggles my mind how willing a majority of people have been to accept this kind of stuff simply in the name of not wanting to have to think about it, or perhaps in the name of being done with it so they can get back to their regular lives. I mean, why do you think people have been so accepting of this whole thing? Are we just dogs doing a Pavlovian response to the mainstream media, or what?
I hate to use a broad brush on the entire nation, but a lot of this has shown that we're a nation of sheep, that we hear something and we're easily driven in a direction. I will tell you, though, I believe people are finding their purpose. They're stepping into their context and they're finding their authority. Where you're seeing that, and this is a pushback to that. At first, we saw exactly what you said. Let me back up. We saw people being driven through a narrative, people afraid to speak up. But what happened is, anytime you have a narrative like this, and for lack of a better word, it's evil. When people are getting killed and they shouldn't die, it's evil.
Thank you. Thank you for saying the word, because that's the one word nobody wants to say, but you nailed it.
Well, it's the problem we have today. It's a problem we have in the church. We don't identify sin as sin. We don't identify evil as evil. It's hard to fix something if you can't call it by its first name.
Yeah.
So we have evil happening, and we also happen along the lines of critical race theory and things like that. But now you're seeing a segment. It's becoming more local. Parents are pushing back. People are pushing back that we would never think would be involved in the public square, that are pushing back. And they're starting to coalesce around the fact that people are being hurt, whether it's their children at school, being masked. We're seeing a massive uptick in deaths, not from coronavirus in children, but from suicides, overdoses. These are hard facts. And parents are starting to recognize this. So the positive side of this is we're starting to see an uptick in people pushing back locally. And if you want to see something change, it has to start at the local level. They are, when I say they, I would say we're becoming I worked in Mexico, Central, South America. A lot of countries, we call them narco states, where narcotic traffickers basically control the government and the state. I would say we're a pharmaco state, where pharmacology is controlling a lot of the levers, big pharma, in this nation. How else could you push a vaccine that doesn't keep you from getting the disease or prevent you from spreading it? How else could they shut down long-term accepted off-label drugs like hydroxychloroquine and ivermectin? And they say things like, well, they're not FDA approved for that. What they're not telling you is once a drug is FDA approved for a certain function, it's legal. And the FDA used to promote using drugs, quote unquote, off label. Once they have their initial approval, means they're safe and effective for that.
Well,
it doesn't mean they don't work for others.
Isn't the therapy, though, ultimately up to the physician and the patient, as opposed to the manufacturer of the drug or the manufacturer's competitor?
It should be, but we have a generation of physicians, what I call woke medicine, which is anything but awake, that are walking lockstep and saying, well, I'm told not to do that. And I can't cut any physician slack for that, because I'm a surgeon. When we couldn't operate, when everything was locked down at first because no one really knew what was going on, I got to my computer, started pulling papers, started reading, and wanted to understand what this was. And what I found out was this is not new. This is most likely man-made. And there were already effective treatments out there, hydroxychloroquine. People were starting to recognize that there were previous treatments for this.
Mm-hmm.
And the way I looked at it is, when I saw something that worked, and then I saw studies come out in peer-reviewed journals that had to be pulled 2 weeks later because they couldn't produce any of their data, that should, in physicians, that should make us question what's going on.
Mm-hmm.
When they came out against hydroxychloroquine and said it doesn't work, and then they pulled that out of the Lancet, that tells me that it's being attacked and it's not correct, that there's no truth there. That's when you have to stand. And
so
a lot of
earlier
physicians did push back. They were just canceled.
Yeah, well, okay. How many physicians does it take getting canceled? Earlier you said people need to step up and course correct. Now, if you're in the line of fire, let's say that you are a physician, and you are, but just let's take a hospital physician, or a hospitalist or a specialist in a hospital. How in the world are they supposed to? Do you think that they should be willing to sacrifice their career, or maybe go the concierge route, or, I mean, I know it's going to take some pretty massive hands on the wheel, but I know that there's a lot of corporate bullying that goes on in the hospital system, because I've known 2 nurses who have essentially been forced out of their positions because they refused to take this medication. How does a doctor cope in an environment like that? And do you think that it's time for more physicians to start adopting an entrepreneurial mantle and saying, no, I'm going to take matters into my own hands. I'm going to pay for my own insurance, and so forth and so on?
Absolutely. I mean, I own several clinics, as well as have a private practice in plastic surgery, and I have an on-site medical company. I provide malpractice insurance for all my providers. We've been treating since day one, back in February, when we identified coronavirus. We've been treating early with therapeutics. We've treated over 4,000 people with 100% success rate.
Mm-hmm.
Now, we haven't had any pushback. We've had pharmacies where the pharmacist would refuse to fill medication, which I think is practicing medicine without a license. But again, all these pharmacies are part of this big pharma regulatory capture, where the large companies are controlled by big pharma. They send out an edict to the CDC and the NIH, which prints up a nice memo from a government agency that sends it to the pharmacies that says these medicines are not approved,
mm-hmm.
and they're dangerous. Now, that's a lie, but I can understand why it would give some people pause. I'm not a fan of lawsuits. I think it's terrible, but I believe that when the dust settles, these pharmacies will most likely be sued out of existence, because the pharmacies that did not fill ivermectin, hydroxychloroquine scripts, they're not going to be able to say legally, well, the CDC recommended I not do that.
Mm-hmm.
And then you would just say, well, do they control what you do? The answer is no.
Mm-hmm.
Is it a recommendation, or is it a binding order? Well, it's a recommendation.
Mm-hmm.
Have you written for this prescription? Have you filled these prescriptions before? Yes. What's the safety profile? And when you start asking these hard questions, I think that you're going to see the growth in personal injury attorneys shoot up exponentially because these folks are actually liable for serious injury to patients if they did not fill these scripts.
Have you seen over the last 20 or 25 years a shift in pharmaceutical marketing messaging from talk to your doctor about to phrases that are more oriented towards pharmacy? You know, talk to your pharmacist, ask your doctor or your pharmacist. Do you think they've tried to attempt to shift consumers towards the opinion of the pharmacist over the last couple of decades?
It's a great question. And I hadn't even thought about it until you asked it, but I would tell you yes. They have switched it. And it makes sense because, again, the pharmacy is owned by one of the three big investment groups. Most doctors aren't. So where can you control the message and control the endpoint, the buyer, the customer? You're not going to control what the doctor does. Pharmacies used to take doctors out to dinner, show them new drugs, things like that. It was all legal. And if doctors thought the drug was good, they would use it. If they didn't, they wouldn't.
Mm-hmm.
But it was more of a shotgun approach. Now, pharmacies have what they call pharmacy benefit managers, PBMs. And the PBMs decide what's going to be on the formulary at that pharmacy. So large pharmaceutical companies realize that doctors are going to write for whatever people can get at the pharmacy. We'll control it at the point of it's not really the point of care as the doctor, but the point of filling that script or the point of medication acquisition is at the pharmacy. Mm-hmm. So it doesn't matter what the doctor writes. If he can't get it at the pharmacy, you know, they can subvert that step. And I think that's what you're seeing. So that makes a lot of sense.
Does it make sense for non-woke physicians to maybe consider getting into the pharmacy business or trying to get closer to the pharmacy business again? And as a sidecar question to that, is pharmacy regulated to be separate and apart from the practice of medicine? Or
that's a state by state regulation. In Texas, some states allow physicians to dispense medication and charge at the office. In Texas, they don't. They want to separate physician-owned pharmacies, so that you're not self-referring. The problem is the pharmacies are being controlled by big pharma, which I believe we're going to have it's going to be a real legislative challenge. Once everything's done, there should be hearings held with big pharma. These guys need to be called to the mat. They need to find out what's going on. You're seeing, gosh, I hate to use this word. I don't know a better word. You're seeing a genocide right now. You're seeing people die that shouldn't die. And I've witnessed it firsthand where people would be sent home and told, go home, come back when you have trouble breathing. Well, we know that's not the way to treat this. We've always known that. Mm-hmm. And so it's a toxic mix of greed, invincible ignorance from physicians or fear. And, you know, then add in the globalists and what they talk about in the Great Reset. And I think you kind of understand what's going on here. And again, it's not a conspiracy theory. It's just the identification of a conspiracy.
So, Keith, I know that you're a Christian. I am too. I'm a Christ believer. I'm frustrated with the behavior of the church. And again, that's a broad brush. I know there are exceptions, and I know there are very notable exceptions that have been censored like crazy. But even in my personal life, my best friend back in Ohio is my pastor, and his wife is a nurse, and they are both full-blown, full-on COVID believers. And this made it incredibly difficult for me to approach him with information that I had about therapeutics at a time when he, frankly, would have benefited greatly from that knowledge. The whole conversation was instantly shut down, but it wasn't shut down in a reasonable fashion. And this is one of the most reasonable guys I know. So for him to just shut down a conversation with me, a guy that I've known for, gosh, probably 20 years, it's something that I have set aside until I'm able to travel, the 1,400 miles that I can talk to him in person about it and see him face to face. say, hey, why'd you shut that down? Why didn't you respond? Why did you say, okay, thanks, and kind of ignore me? What do you make of that? And have you seen that among other Christians and other pastors as well?
Sure. Christians are humans. And it all goes back to, I came to the game late, but I always go to the Word of God, the Bible, where what was the one tree that God didn't want Adam and Eve to eat from? It was the knowledge
Mm-hmm.
of good and evil. And so a lot of Christians are intellectualizing things instead of listening to their heart and following what God calls us to do. So instead, they live in fear. There's never a time in the Bible where God says, do this out of fear. If it's a pastor, another church member, another believer, if you're being driven by fear, you immediately know that the root there is producing no fruit.
Well, there's only one
Bad
thing
root.
that I'm aware of that God commands his followers to fear, and that's him. I think
Right.
everywhere
And then
else in the
that's
Bible, he says, don't fear.
we mentioned it briefly earlier. I would tell you the two things I see right now in the church that's caused us to struggle. Number one, we no longer call sin by its first name. We have a lot of pastors that don't want to offend, so they don't talk about what the Bible talks about. I heard this the other day. It's basically a hot dog church. You come to church, now you could get revelation, you could get prophecy, you could get sanctification, you could get all of this stuff. What do you get? Hot dogs.
Mm-hmm.
Everyone likes hot dogs. And
It's like Planet
but I want some
Fitness. You go
prophecy.
in for a workout, and then you walk out gaining 3 pounds because they serve pizza right by the workout
Right.
equipment.
And so we don't call sin by its first name. And the bigger thing is, and I think this is critical for all believers, is we have lost the fear of the Lord. Because if you fear God, you fear nothing else. If you
Yeah.
don't fear God, you fear everything else.
Yeah.
And so in your life, where God calls me is, my faith is something where I've seen it supernaturally. That's how I came to faith.
Mm-hmm.
The Lord showed up in a big way. I wasn't the best person. I tell people you're going to get it through situation or revelation. Revelation's much better. Now, I can't speak to your pastor, but if he's not willing to engage and talk to you, then there's a root in his life he's not dealing with. And he's covering it up. I'm not judging him. I'm just speaking to bad root, bad fruit. There's no fruit there. If there's no fruit of the Spirit, if you can't talk about it. And truth, the Greek word for truth is aletheia. Hebrew word for truth is aletheia. Aletheia means reality. And everyone right now in the main church, we're seeing what our truth is, our cultural truth. You hear people say, well, it's not my truth. Truth is reality, and God is reality. And so
well, quantum thought has infected the mainstream. The intellectual church is really being bothered and distracted by the whole notion of quantum reality and quantum truth and stuff like that. Gabby McAllister and I were talking about that on the Trouble in Paradise podcast a couple weeks ago. And she too is a person of great faith. It's a mind-boggling concept though when you get down to it. I want to ask you something, Keith. Do you think the big technocracy do you think they really think a majority of people take issue with guys like us and guys like Joe Rogan? Because I don't think either one of us has said anything today that hasn't already come out of Joe's mouth. Like, do you think that the people that run this thing are so stupid that they believe that Joe is not disliked or that they can cause him to be hated?
I think they're desperate. I think they only have a few arrows in their quiver, so they can. The thing about big tech is, the reason they do the same thing over and over again is because it works. And they cancel. That's what they do. They cancel you or they talk about you. When you don't have any good ideas, you attack the person. Joe Rogan didn't attack any people. He attacked their ideas.
Mm-hmm.
And so what they're doing now is they're attacking the person. What they didn't recognize is we all have a personality. It's a God-given personality that's inside of us. The disc profile probably best won't go down in the weeds, best explains it, but Joe's personality is not one to back down. And he's seeking truth. Now, I don't agree with a lot of the things he says, but I like the way that he is seeking truth. So when they went after him, his personality wasn't one to go, oh, I better back down.
Yeah.
But it was to double down and to seek truth. And that's the thing right now is with it's amazing how pastors will back down, yet Joe Rogan is keeping truth from being an orphan because he wants to know truth, and truth is reality. Joe's reality was he got better because he took the right medication. And he has a moral base to him that tells him he doesn't want other people to die.
Yeah.
And he had probably more to lose than anyone if big tech attacks him.
Oh,
and
yeah.
He didn't,
with the Spotify deal that he got. Yeah.
Right. And so, and physicians need to step up too. At the end of the day, my responsibility is to live my life the way God calls me to live it.
Mm-hmm.
I live in fear of the Lord in a reverence that I don't want to not hear God.
Mm-hmm.
You know, I don't want to not understand what he wants for me in my life. It brings me a lot of joy. It doesn't mean my life is perfect.
Mm-hmm.
But if you have that, then I can have a conversation with anyone. And I don't do it where I get, oh, I can't believe you think that. I like to hear people explain, and then I explain. And if you have two people that are on the same wavelength, you can talk. Once you have someone shutting you down, they're not open to the truth. And there's a root there. There's something there that is causing them just to run in the opposite direction. And
so you just
fear.
named a primary convention or a primary mechanic of censorship, which is if you shut up any party who's at the table, you can only produce non-truth at that point. If your tactic is to shut people down so that they cannot speak, what's left in the vacuum of their speech and thought isn't the truth because it's been altered by your tactic of censorship. And I wish that would dawn on people so that they could get a little bit ticked off and, start leaving these platforms that are shutting them up and manipulating and controlling the conversation. And I think it is probably very frustrating for big tech because they have this great thing on their hands in terms of Joe Rogan. Why not send that guy an olive branch? Why not try to, get a little closer to him and allow him to ask questions that they can then justify? And I think the answer is they can't justify what they're doing. There is no way that a Jack Dorsey or I want to say Bill Gates because he's a big connecting rod between pharma and technology, but there's no way any of these guys can sit down with somebody who's not going to hear BS and be able to overcome the open questions that Joe is asking. Yet, if they turn around and try to shut him up, no truth can possibly come of that. In other words, the censorship is the mechanic. So if you're trying to shut somebody down and make them leave the table, the truth gets smaller and smaller and smaller. And like you said, it's orphaned. So I got to ask you, Keith, how do people get a hold of you if they'd like to reach out?
They can go to my website, thescalpeledge.com, and just click the button there. If they want to email me, there's all kinds of email addresses there and ways to get in touch with me. They can go to the podcast. It's on Apple, Spotify. It's on all the podcasts, and just click The Scalpel with Dr. Keith Rose. Hit subscribe. It's free.
And it's
For me,
worthwhile.
It's just cheaper than therapy.
Yeah, and, give it a listen.
But the important thing is I would ask folks to look inside their heart. We're all created for a purpose. And right now with COVID, people have had a lot of time to sit alone and wonder why we're here. I was talking to someone the other day and he asked me, he said, Tiger Woods is a great athlete, isn't he? And I said, yeah. He goes, he's a great golfer. And I said, he's amazing. He goes, how do you think he would be as a football player? I go, terrible. He goes, right. Because he was in his context and his purpose. Mm-hmm. What we need right now is for people to step into their context and their purpose locally and at every position in their life if we want to take back this country. And then they'll find the courage and truth won't be an orphan.
Indeed. Everybody get a hold of Keith Rose at the Scalpel Edge podcast, and the website is scalpeledge.com. Is that right?
Scalpeledge.com. And they can also go to our Twitter at the Scalpel Edge. Okay. At the Scalpel Edge, I believe is our Twitter handle.
Okay.
You can tell I pay a lot of attention to it. We answer all the emails we get. We try to encourage folks, and we want people asking questions. And podcasts like yours, I love it because you're not just saying this is bad, you're doing something about it. And we need more and more people doing this.
Well, yeah, I agree with you. And I'll be praying for your podcast to reach a wider audience and for your greater success. In the meantime, I'm not sure if this one's going to go up on YouTube. If it does, it probably won't last very long. But you can find the Big Tech Watchdog on YouTube at the Trouble in Paradise channel. And of course, if you want to reach me, it's trouble@trouble239.com. And I'm at Nigel Kent 239 on Twitter and a couple other spaces. I'm sure you can find me on Gab, Getter, and the rest. Dr. Keith, thank you so much for joining me today. I hope we get a chance to talk again.
Yes, sir. Thank you for having me.
You got it.